Hi, my name is Lily. I use they, them pronouns, and I'm here to talk to you about our Trans Health Awareness Workshop series. We forgot to record the first part of the first workshop series, so I'm re-recording the beginning. We remembered halfway through, so you will have a part of the original recording there, but caveat, might be a slightly different experience, not that much, the slides are the same. Our first workshop today, we're going to be talking about mental health and minority stress, the impact of living in a transphobic world. Authors are me, the wonderful Tiffany and Johnny, which you'll see their lovely faces presenting and hearing their lovely voices. And then we do want to acknowledge that a lot of our slides were helped by Lily Lear. Our outline for today, I'll just leave that there for you for a second, and then we will continue on. We will start the presentation talking about some different transgender and gender expansive definitions, but we do want to have a caveat that we acknowledge that language evolves and that things that may have been commonly used in the community just a couple of years ago may have changed and come out of favor. So just so that we can date ourselves, this is a workshop that is done in March 2023. We will start with AGAB, AFAB, AMAB. These are just vocalizations of those acronyms you see up there relating to assigned gender, assigned female, assigned male at birth. This is a thing that is preferred over the previous use of MTF, male to female, or female to male, FTM, that you will see very frequently in the literature. And there's still like a connotations you should know about, but AGAB, AFAB, AMAB puts it on an action that was assigned to them rather than defining them first in your paper as the sex they were assumed to be at birth and not who they are today. And then we get gender nonconforming and gender expansive. These are two umbrella terms kind of meaning the same thing that are used for somebody whose gender does not match their sex assigned at birth. You'll see a lot of more people moving towards gender expansive because the assumption sometimes with nonconforming is that it's like atypical, and gender expansive kind of moves away from that, but both are very commonly used in the literature. Then we have transgender, which we should note is an adjective. It should not be used as a noun for somebody whose gender does not match their sex assigned at birth. We also have cisgender, which is an adjective, again, for somebody whose gender matches their sex assigned at birth. More things that you might hear, so transmasculine, typically somebody who's assigned female at birth but identifies more with masculinity. Transfeminine, typically somebody who's assigned male at birth but now identifies more with femininity. Non-binary, somebody who does not identify as exclusively male or female. Then we have something like genderqueer. This is a person who does not subscribe to conventional gender distinctions, identifies maybe with neither, both, combo, and recognizing that gender is a spectrum, that combo can be whatever percentage of whatever genders they want. There's also the concept of gender fluidity, which usually is used to describe a person who will feel more feminine or more masculine depending on their mood and stuff like that, and may even change their pronouns throughout the course of the day. It is important to use the language that people give to you because that is how they identify, which I know it can be difficult. There's a lot of words, but people find a lot of comfort in finding the word that they feel like describes them the best. It is important to use the language that people give you to describe themselves and to not make assumptions. Gender is a spectrum, and people will find new words to describe how they're feeling every day, and that's fine. Just use what people tell you is the most important thing. The exact definitions aren't the most important, even though I just gave you a whole bunch of definitions. They are also fluid. It's also very important in this definitions section to talk about the concept of gender dysphoria. On the screen there is the National Health Service definitions, but I think it can kind of be boiled down with just a great sense of unease and discomfort in living in a body that is not the one that matches who you want it to be, typically due to your gender. Gender identity and gender expression are different concepts. Gender identity is your innate sense of self, what your gender is. Gender expression is typically the way that a person would express their gender identity, typically through their appearance, their dress, their behavior, their vocalizations. Society tends to have preconceived notions of what is masculine or feminine, But it is important to note that gender identity and gender expression are completely different things. You can have a person who is very confident in their femininity, but dresses in more masculine clothing, like a tomboy, quote unquote. And you can also be a guy who is very confident in your masculinity and dress up with makeup or nail polish.
I wanted to start with a poem. This poem is titled When My Gender's First Name Disorder by Tran Greathouse, who is a poet in the transgender community. Do they mean this as a synonym for disorganization, machine with excess parts? If I called the parts of me I no longer want vestigial, this would imply they were the vestige of a once boy, remnant of a never was. Perhaps they mean it as disruption in the neat arrangement of a system. Misplaced chromosome, missing rib, screw balded as a knuckle, first cell to metastasize. Our language unable to speak my gender out of disease. Breasts growing like tumors from a lab rat's spleen. Cells in disarray. Gender as etymology of abrupted skin, as melanoma severed. The scar a creeping ulcer leaves. My clutter of apoplectic nerves. Spine a chaos of misplaced bone. Trace vestigial back to its oldest root, and you will find a footprint in the dust. Trace my gender back to its oldest root, and you will find my father's footprint on my chest, sinking all the way down to my blood. I thought the poem was a nice way to ground ourselves as we talk about minority stress theory. And this theory is a framework of understanding how societal discrimination and stigma translates into mental health disparities, particularly in the transgender community. There are three components of minority stress theory, and I think of these as processes that feed into each other and create more psychological stress. And these are one, external stressful events, two, the vigilance that comes from expecting these stressful external events, and three, the internalization of negative societal attitudes as a result of these events and the vigilance that results from them. And I think it makes a lot of sense that if you're experiencing such high stress all the time in your daily life, there's a high burden of mental illness. And you see that in the high burden of mental illness among trans folks. And I think it's also important to understand that stigma and discrimination operate at many levels in society, not just at the structural level. And so there are individual, societal, interpersonal factors that all play into this. And I think this graphic does a good job of illustrating that. You can see that there are many domains in which transgender folks experience stress, such as healthcare, education, housing, the legal system, violence, and even interpersonal relationships. And all of this feeds into psychological stress is that then in turn generate mental and behavioral health disparities that we see in the literature. And I also wanted to ground this conversation on mental health by acknowledging the harmful role that the medical community has played in exacerbating mental health disparities among gender minorities. And I think this paper puts it really well when the authors say that, quote, defining gender as an illness or otherwise abnormal is unfounded, discriminatory, and without demonstrable clinical utility. Psychological trauma and suffering are not inherent to trans people, but are the result of society's failure to embrace body diversity. Historically, the medical community has pathologized trans folks and gender minorities. And honestly, it still does. And I wanted to just point out a few examples from recent history and current history that demonstrates how the medical community pathologizes minority gender identities. The first is the ICD 10 and 11 codes, which are used in a lot of billing purposes in the medical system. The ICD 10 listed a bunch of these outdated terms under mental and behavioral disorders. And the ICD 11, although it removed trans identities from mental disorders, still pathologizes intersex folks and still lists gender incongruence as a condition. And I really want to emphasize that the psychiatric community has also contributed to a lot of this harm and that is honestly ongoing. The DSM has historically described minority gender identities as disorders, such as the examples listed on this slide. And currently, it lists gender dysphoria as a diagnosis. I want to emphasize that having a gender identity outside of what you were assigned at birth is not a mental illness. And so, frankly, it's upsetting that this is still listed in the DSM. However, it is an important diagnosis if patients want to receive gender-affirming treatment, particularly surgery. So, for example, if a patient wants to get gender-affirming surgeries, they might need a gender dysphoria diagnosis for a period of 6 months or more in order for the surgery to be covered by insurance. There is some change, though. Recent revision to the DSM says that not all trans people may experience gender dysphoria, although there is still a long way to go. And Kaylee Whalen put it well when they said, quote, as long as transgender identities are understood through a, quote, disease framework, transgender people will suffer from unnecessary abuse and discrimination from both inside and outside the medical profession. And I want to turn it over to Johnny, who will be talking about discrimination.
Not only is there discrimination against a person's identity, but trans people may also face discrimination in multifaceted ways based on their race, ethnicity, sexual orientation, and so forth. And a lot of these translate to the impact on the workforce in the healthcare setting, as well as violence against transgender people. So looking at some of the statistics just by the Center for American Progress in 2020, just to put things into perspective, over 60% of transgender people that year experienced or reported discrimination. More than one in four had reported significant psychological harm due to discrimination. 50% have experienced some sort of public shaming or discrimination in public spaces. As well as 2/3 of transgender people felt that they needed to change their mannerisms, behavior, or the way that they dress to avoid being discriminated against. When we look at how this affects transgender people in our community in the workplace, so a broken bargain for transgender workers every year do a comprehensive analysis of a lot of different inequities facing transgender people in the workplace. And unsurprisingly, transgender people face twice the rate of unemployment compared to the general public, 14 to 7%. More than 4 in transgender people who are currently working are underemployed, and transgender workers are 4 times more likely to have a household income under $10,000 than the general population, which is much more lower than the poverty threshold. And despite transgender people and studies showing transgender people have higher rates of education levels, they're still more likely than other Americans to be underemployed, have lower incomes, and live in poverty, despite obtaining a higher education level. And I think that this is pretty disheartening. When we're looking at how discrimination and the interplay between transgender violence, it's really a multitude of things that can contribute. Yep. And so really the dehumanization of transgender people begins with a lot of legislation, policies that discriminate against transgender people that then feed into this denial of opportunity, be it creating barriers to obtaining healthcare, and so forth. And much of these lead to further stigmatization, as well as further propagating risk factors such as various health disparities, as well as higher incidences of violence. So in 2013, the Human Rights Campaign began tracking cases of anti-transgender attacks and violence. And over 200 have been reported so far, but that number is very much underestimated given the many cases that have gone unreported. And what's even more striking is that when we look at the rates of homicide, 4 in 5 transgender women of color are victims of homicide. And compared to the general population, transgender people are 2.5 times more likely than cisgenders to face violence. And so, as you mentioned before, where this violence also stems from, policies and stigmatization is a big factor. Just in 2021, we had 184 bills, anti-trans bills, that were introduced through legislation, and this was record-breaking. And when we look at how this impacts members of the community and their health, well, the disparities not just stem from the violence, the acts of homicide, as well as employment discrimination, but it also affects their ability to access healthcare. And so transgender adults are more likely to be uninsured, 19 to 12% than the general population, report higher rates of barrier to cost. And this is more pronounced amongst non-Hispanic, Black, and low income compared to cisgender adults. And when we look at insurances, across the board, about half of transgender adults have been denied by insurances for gender affirming care, be it obtaining access to hormone replacement therapy, health matters related to their sexual health. And so as a result, more than half of transgender adults have felt that they needed to avoid obtaining healthcare just due to the rising cost being a barrier, and the lack of coverage. And finally, kind of to wrap things into context is, I think that this graph kind of really explains things very well, right? The expectations versus the reality. Society sometimes thinks that, pronouns and the issue of bathroom bills are the only things that members of the transgender community face. This is just a small subset, right? So things related to violence against transgender people, difficulty accessing care, the lack of uneducated medical professionals in providing culturally competent care, and then just being recognized as a member of society. I mean, these are various issues that the community is fighting for. And so really, it's much more multifaceted. And in that regard, I'm going to hand it over to my colleague, Lily.
So now I'm going to talk about the mental health impact of living in a world that is transphobic and has all of this violence towards folks who are trans. You will see me talk quite a bit about the U.S. Trans Survey. It was done in 2015, and it is one of the most comprehensive surveys of trans folks in the U.S. It had thousands of respondents. They're doing another one. Results should be out in the next year or so. But until then, that's the data that we have. And they found that 39% of their respondents, so these are folks who identified as trans or gender diverse, reported experiencing serious psychological distress, which is nearly 8 times higher than the US population. Looking at the graphs, these are taken from the US Trans Survey as well. Folks who reported any amount of distress in the past 30 days, you can see that over 90% of the trans and gender diverse people who responded noticed that it was impacting their day, interfering with their ability to do things that they wanted to do. When we take this in comparison to a survey of the US population, which again, less people report serious psychological distress, and the people who do report any sort of psychological distress, a large percentage, I think 65, I'm bad at math, report that it doesn't really impact their ability to do things. So you might be wondering, what is severe psychological distress? It is this scale that you can see kind of listed off there that measures basically symptoms of anxiety, depression. You can read them through. It's like tiredness, nervousness, hopelessness, fidgetiness, depression. And you need to get 30 or more points. You can see the scaling on the side in order to be qualified as severe mental health disorder or in severe psychological distress. Interestingly, they found that this distress varied across gender identity, with 49% of non-binary respondents having psychological distress, 35% of your binary transgender men and women, and a couple of folks who were just cross-dressers did the survey as well, and their distress is less, which shows that it isn't necessarily about dressing as the gender expression different than what society expects you to be, there is something more going on than just that. They also found that distress varied by age, and as you got older, the distress decreased over time. Mostly they noticed it in the young adults, and it's a pretty steady trend line down. But all age groups were higher than the US population on average. But good news, the distress decreased as time since beginning transitioning increased. So it was pretty high amongst the people who were 0 to 1 year with their beginning of transitioning, and it petered down a bit. Like, it's still high, but it's significantly less as time went on and people were able to exist as they are. This does have an impact with the high rates of discrimination, stigma, unemployment, and these mental health challenges in transgender folks. It does lead to a higher risk of substance use disorder than other people. So it is very important to screen everyone for substance use, but also being particularly mindful in this particular community. But I think anyone and everyone should be screened for substance use disorder because it can affect anyone. But we find that substance use tends to start a little bit earlier. So it typically begins in adolescence and early adulthood. This might stem from a way to deal with the stress of fear, or the stress of fear of rejection, or concealing your identity. But it was much higher than cisgender people. So in general, any drug use was 3.6 times higher amongst transgender folks. And then there's also 5 times higher the rate of marijuana-related substance use disorders. This isn't just like casual marijuana use. This is like actively impacting your ability to do things, because that's what a substance use disorder is. 4 times the rates of cocaine substance use disorder and 3 times the rate of opioid substance use disorder. And you can see also that in the graph over there, like there's also higher rates of nicotine use and alcohol use. So just be mindful and screen everybody, but in particular, coaching folks in reduction of substances is beneficial, particularly in this population. Now, this is a little bit of a side tangent. I fully recognize that, but I want to bring up the intersectionality between neurodiversity and gender diversity, because there are a group of people that feel like neurodiverse people, when they have gender diversity, they should be scrutinized harder and with more intensity before they're able to access gender affirming care. So there have been a few studies lately that shows that gender diverse people were 3 to 6 times as likely to be autistic after controlling for age and educational attainment. For your own context, the rate of autism spectrum disorder is about 1% of the world population, according to the CDC. Gender diverse folks were also more likely to report symptoms of autistic traits and suspect that they had some level of undiagnosed autism. In addition to autism, there's been a couple of studies on ADHD, where they have found that folks who have ADHD are more likely to question their gender and be gender diverse. There are some hypotheses why this increase, or why there is a high rate of gender diversity in the neurodiverse population. It could be that gender diverse folks report having autistic traits due to a longstanding feeling of not fitting in socially. Also very likely that neurodiverse folks are less concerned with social norms, so they're less likely to conform to gendered expectations. There's theories that impulsivity may make it more difficult to hide your gender, and there's possibly a neurodevelopmental mechanism that can contribute to both. What can we do with this info? Well, both neurodiverse and gender diverse people are marginalized groups with inadequate access to support and understanding and healthcare. Being mindful of this correlation between the two groups can help us support our patients on their gender journey, and maybe we should also be a little introspective if we try to gatekeep people from getting gender affirming care solely due to their neurodiversity.
I think that the next slide shows one of the most widely circulated statistics about mental health in the trans community, which is that about 40% of respondents to the US Trans Survey have attempted suicide at some point in their lifetime. And I think it's important to point out that this is almost 9 times the rate in the general population. I think what's more alarming is that this disproportionately affects young trans teens and kids. And a lot of the stressors come from home and from school. So you can see in this middle column that almost a third of trans teens feel unsafe going to or from school. About a third are bullied. And as a result, there's a really high burden of suicide attempts in this population. Next, I want to talk a little bit about some of the increased risk factors and protective factors for suicide in trans teens and trans patients at large. So some factors that increase risk are experience of discrimination, mistreatment, violence in education, employment, healthcare, physical attacks, denials of equal treatment in services or public places, and rejection by family or religion. And I think all of those make intuitive sense. The protective factors also make intuitive sense to me. That's mostly, like, by and large, just like support and changing societal structures. So that's school belonging, family and social support, access to gender affirming care, whether that's puberty blockers for adolescents, surgical or medical treatments as adults, using people's chosen name, and being surrounded by supportive classmates, coworkers, family members, and community members. And I just feel like this is an important time to reemphasize that, like, if you have trans patients, it's really important to assess for suicide risk and provide support where and when you can. I'll pass it to Lily.
We'll also talk a little bit about the concept of detransitioning, because it is a common thing that people will bring up as concerns about why people shouldn't be allowed to transition, because what if they regret it? What if they detransition later? So we wanted to make sure that we covered this topic because you'll probably hear about it. So what about detransitioning? So the survey that I mentioned earlier found that 8% of the adult transgender population either permanently or temporarily detransitioned. But if you look at this graph on the side, you'll see a whole bunch of reasons why people detransitioned. And only 5% of that 8% was due to realizing that the gender transition was not for them. It is a lot of the societal pressures and the transphobic world that made people feel like they couldn't live as their gender identity, either permanently or temporarily. So whether it's like pressure from a parent, a spouse, family members, all of the things that you can see. And the majority of people who detransitioned also did so temporarily. So 62% of those who detransitioned reported that they are currently living at a full time in a gender different than the gender that they were thought to be at birth. So it's definitely seemed to be kind of a temporary thing. Now, pediatric edition, because a lot of the news is about protecting children and the intent to not let kids harm themselves permanently. As always, a caveat with all things, we do need to do more studyings, but it seems that detransitioning is also really rare in pediatric patients, with only 2.5% in this one study of 300 some folks detransitioning back to their assigned gender at birth after 5 years. And I think it was around an additional 5% went from a binary trans identity to going to non-binary. A majority of these folks who did detransition were kids who had socially transitioned prior to the age of 6 and ended up detransitioning before the age of 10. So even in the pediatric population, it's pretty rare. And like once you start hitting puberty, the rate of detransitioning like plummeted, and folks tended to stay with their gender identity for 5 years, which is what the study was looking at. While we will cover transitioning more in depth in later workshops, it's important to note that the vast majority of pediatric transitioning is reversible. It's mainly just social transitioning, calling people preferred names and pronouns, and letting them have the gender expression that they want. And maybe once you hit puberty, some puberty blockers. We'll cover it more in future workshops, but like if you are worried about that 2.5% that is considering or that might detransition, yeah, so it's temporary. So it's not going to be like a long-term impact because of TLDR. And it's also important to note that gender and sexuality can be fluid and evolve over time. Having a supportive environment that allows for exploration can allow kids to find comfort in themselves, and being accepting through all parts of the journey and being open is important. I also wanted to touch on a little bit of a happy note before we kind of start thinking about wrapping things up. I wanted to discuss gender euphoria because we started the talk talking about gender dysphoria. We're definitely going to talk about gender euphoria a lot later on, but it's the joy in living in your gender. So it's basically just celebrating who you are and being able to exist as that. It's important to remember that gender dysphoria does not define transness. It is not a part of the definition at all. You can be trans without the dysphoria. However, dysphoria is a frequent thing that trans folks do experience and can act as a catalyst for wanting to transition. We'll cover gender dysphoria in much greater depth, euphoria in much greater depth in the gender as a social construct discussion. In general, it's important to celebrate trans joy and resilience. There's always annually a Trans Day of Remembrance, which celebrates, and not necessarily celebrates, it celebrates the lives of folks who didn't make it. But it's also important on days like that to not just have it be about the deaths and the sadness, because while the deaths and the sadness are great, it is also important to celebrate the trans folks who are existing as they are. Also, a good important note is reducing suicidality via gender affirming care is amazing. It's super cool. And it's not the only reason for gender affirming care. People deserve to be themselves. And a lot of people can feel like the medical professionals are only saying like, you only do gender affirming care because it reduces suicide risk, which it does. It does reduce suicide risk, but that's not the only reason to allow people to exist as they are. What can we do? This is kind of a brief how to ally. Introduce yourself with your own pronouns, which normalizes saying pronouns. It's folks who might not want to share their pronouns with you at first might, after you say, hello, my name is Lily, I use they them pronouns, then your patient is more likely to share theirs. We want to practice using different pronouns. This is particularly important if it's someone that you work with often, because seeing their face and being like, yes, Lily, they are an excellent medical student, whatever, and like normalize saying those things, it really does help and kind of helps get those pronouns correct in your brain. If you make a mistake, quickly apologize and move on. It's okay to make mistakes, and it's not okay to purposely not use the correct pronouns. Folks realize, especially if it is you like came out as non-binary or trans to people who have known you for a long time, like it can be difficult to get that mindset shifted. Just apologize quickly, move on. Don't make a big deal of it, because it's not about you and your need for forgiveness. It's just like, I recognize I fucked up there. We'll continue on. I will use the correct pronouns from now on. Using someone's name and pronouns as they give you is important. This is both important for using the terms that people give you and their things, and also recognizing that there might be different contexts where you need to do different pronouns in different contexts. For example, a teen might not be out to their parent yet, and for safety, may need to use their dead name. So if you are talking, particularly in this teen population, or amongst adults who don't necessarily want their medical record to have the fact that they are trans in it, because again, the medical society can be stigmatizing. Ask people like, is it okay if I use your name and pronouns in your note? Is it okay if I talk to your parents with this, or would you prefer me to use a different name? It does make it a little bit more tricky, but most EMRs have like a little sticky note function that you can put and be like, okay, this is the name that I want to use when I talk with them. This is what I'm going to put in the chart. And that is like information that is for you, and typically will follow that patient only when you are talking with them, not necessarily with the wider medical society. When you are a boss, which will hopefully be someday, and you have the power, make sure that everyone has training on asking and using their pronouns. It can be really disheartening if one person, even if it's just if just one person kind of messes it up, it kind of can put like a little bit of a gray cloud on the whole situation. So when you are your own boss running a clinic, make sure that everyone kind of has training on asking and using pronouns. This is a little bit down the road. And like we talked about here, avoid pathologizing gender diverse people. Some things, mainly surgery, still requires a gender dysphoria as a diagnosis. It's typically for about 6 months. But important to note, HRT is typically covered by endocrine disorder unspecified, which can be used to get people on hormones. But you do want to have a conversation of if you feel like you might be pursuing surgery in the future, you need to have gender dysphoria down for a set amount of time. So if you are looking into that, we can put that down now. If you are like, no, I'm never going to get surgery, then great, we can just keep you as endocrine disorder unspecified. Be mindful as a medical provider that patients can read their own charts and diagnoses now. This can be particularly impactful with ICD-10 codes. It's just being mindful that people can read their own charts and diagnoses and trying to avoid stigma in your codes and stuff like that for billing.